There have been 27 new positive cases of COVID-19 reported in the last 24 hours. Despite this, there's been a further decline in the total number of active positive cases, which today stands at 1,609, a drop of 52 over Tuesday's figure. Meanwhile, the Ministry of Health reports that there are 103 patients in hospital, one less than Tuesday. 60 patients are being treated at the Kuva Hospital and Multi-Training Facility, with 5 of them in ICU, while 2 are in the High Dependency Unit. 3 patients remain in ICU at the Arima Hospital, while there are 21 patients at the Kora Hospital and 18 at the Scarborough Regional Hospital at the Fort. Doctors, meanwhile, are seeing a disturbing trend where people with chronic diseases have been neglecting their health during this COVID-19 pandemic. This according to endocrinologist attached to the Ministry of Health, Dr. Teelucksingh, who attributes this trend to the lockdown measures and fear. Khrystal Wilson has more in this report.
A call from one medical doctor for people with chronic illnesses to take better care of themselves. During the Ministry of Health's virtual media briefing to update on COVID-19 matters on Wednesday, consultant and endocrinologist Dr. Teelucksingh said people who suffer with chronic diseases have put their health care on the back burner. He said things got worse when lockdown measures were implemented.
Now, during the lockdowns, people were rightfully afraid about going to hospitals or health centers, perhaps to seek care, because of this fear of perhaps getting ill while waiting in the accident and emergency. So many persons stayed at home. So there was misconstrued advice saying to stay home, stay safe. However, they stayed at home with many of their chronic, poorly managed conditions.
Dr. Teelucksingh said proper diet and exercise were also shelved during the lockdown.
Coupled with that, there was a tendency to have poor diets and a sedentary lifestyle, once more perhaps as a result of fear of exercising. And we know that those remain the pillars when we're dealing with these chronic illnesses. Your meals rich in fruits, vegetables, peas and beans, low fat and low salt, and fish. And avoidance of a sedentary lifestyle for perhaps 30 to 60 minutes for most days in the week, whether you're running, walking, dancing, or Zumba in somewhere.
The SWRHA medical consultant reminded those who suffer with diabetes, hypertension and heart conditions that they are at higher risk of infection and contracting COVID-19.
Many patients with chronic problems like diabetes, high blood pressure, or heart disease have reduced levels of immunity, and that puts them at a risk for pneumonia, lung failure, and death. So septic shock and multi-organ failure.
The medical consultant said people at high risk should continue to avoid close contact settings, crowded areas, and closed spaces. Khrystal Wilson, TTT News.